45-year-old male presents with expanding lesions on the face, which he describes as scarring, as well as patchy hair loss. Again, pause the video, write down or have a think about what you see and how you would describe this. So these are well-demarcated erythematous plaques with areas of central hypopigmentation and peripheral hyperpigmentation. The scalp shows patchy hair loss, likely representing scarring alopecia with post-inflammatory hyperpigmentation changes. What is your differential diagnosis given the pictures? Multiple SCCs, sarcoidosis, granuloma faciale, atypical infection, discoid lupus erythematosus. Although only 5% of patients with discoid lupus get systemic lupus, what signs, symptoms, and investigations would you do to establish if the patient actually had systemic lupus? Some of the signs include malar rash, discoid rash, photosensitivity, and oral ulcerations. Systemic features to look for include arthritis, serositis, including pericarditis or pleuritis, renal involvement with proteinuria CAS, neurologic involvement involving seizures, and hematologic involvement involving pancytopenia, as well as laboratory signs such as positive ANA, anti-DNA, or anti-Smith antibodies, as well as antiphospholipid antibody. If you wanted to perform a biopsy, what type of biopsy and where would you preferentially biopsy from? So you would do histology to confirm features consistent with discoid lupus from an active, preferentially untreated lesion. You would then perform a biopsy for direct immunofluorescence for the lupus mantis. This is often better to be taken from an older, untreated, and non-sun exposed site if possible. What management could you institute if the patient had confirmed discoid lupus with no systemic involvement? Avoid exacerbating triggers such as UV light and smoking, potent topical corticosteroids, tacrolimus ointment 0.1%, intralesional triamcinolone, hydroxychloroquine 200 milligrams BD and then taper to 200 milligrams daily, acitretin, azathioprine or mycophenolate, or a TNF alpha blocker.